Yes, good morning, Marianne. And how are you with the pandemics? I know a lot of mothers down there are really worried how to protect their children and how to protect their newborns. So can you tell us a little bit about that? But before, would you tell us a little bit about yourself first?
Yeah, sure. First, I'm very pleased and honored to be with you today to share my experience and knowledge as a healthcare provider and as a mom. I'm a Lebanese licensed nurse and previous nurse instructor. I have more than 10 years experience in nursing education and patient family education. I obtained a Bachelor of Science in Nursing and Care and master's degree in nursing research from St. Joseph University in Lebanon. Currently, I'm working as a healthcare coordinator at Fawzia Sultan Healthcare Center. It's a non-profit multidisciplinary organization that offers many healthcare services such as children rehabilitation, mental health and wellness, physical and occupational therapy, neurological rehabilitation, elderly care, newborn care, and women's health.
Nice.
Currently, we are also providing a newborn care training program that can help the most nervous first-time parents feel confident and empowered about caring for a newborn in no time.
Nice, and it's a very well CV, our guest today, doctor. Let's go to another topic. What frequent medical problems are encountered with newborns, doctor?
Yeah, I can tell you about colic. Colic is a common problem for newborn. Let's discuss about the colic. What is colic? Colic is when a healthy baby cries or fusses frequently for a prolonged period of time, more than 3 hours a day. The colic can start a few weeks after birth and worse between 4 to 6 weeks, and it will go by 3 months to 4 months. The symptoms can be crying for no reason, he's not hungry, we change the diaper, crying around the same time each day, often towards the end of the day, clenching their fists or curling up their legs, also turning bright red when crying. What's the cause? It could be pain or discomfort from gas or indigestion, a digestive system that isn't fully developed, overfeeding or underfeeding, it could be sensitivity to formula or breast milk. Also, it could be emotional reaction to fear or excitement. How to avoid this colic? We can avoid possible triggers and soothe them. How? If you are breastfeeding, keep track of what you are eating and drinking. Every time you consume, what you consume gets passed to your baby and can affect them. For example, you should avoid caffeine and milk products. Babies often swallow air during feeding. You should burp the baby often. If you are breastfeeding between the two breasts, if you are changing your breast, you should burp your baby. And if you are bottle feeding, you should every 60 cc also burp your baby. Now I will show you some tips how to burp your baby birth. Let's see. You see this baby newborn. First of all, I will show you how to handle a baby. Always we should handle their neck and hold it like that, okay? Let's see. Upright, okay? We put in our shoulder. For sure, we should put a cloth here to protect our clothes and protect the baby, okay? And we should hold their neck, okay? With this hand. And then tap slowly. Not tapping, slowly. This first things you can do it. And second, also you can provide skin-to-skin contact to soothe the baby. Mm-hmm. We can also swaddle your baby, sing for your baby, giving a warm bath but not a hot bath. And also we can put a warm towel on their stomach.
Indeed.
Also we can massage the baby. For massaging the baby, also I will show you a tip. For massaging the baby, we have the belly button. Here the belly button. Okay, as you can see, we do circle motion in the belly, 1, 2, 3, 4, and then we should do 2 from up and down, up to down, 5 times up to down, and then we can do this thing. I love you.
That is a very fine thing. Marianne, I think this is really nice. I love you, the massage. I think, yeah, it is.
Love you. 2 to 5 times, and in the end, with our tongue, we can stretch.
Oh, yeah, stretching. I think, Marianne, I think stretching are 2 times a day. I do to my kids in the past when they were really babies. What are the safety guidelines for taking care of newborns, especially during this pandemic and COVID-19? A lot of mothers really are worried. Are our babies gonna get contagious or contacted by that COVID-19? How to protect them? When they are going outside, they are putting the shield over some of the babies I have seen around.
Look, while many mothers are excited to introduce their baby to family members, social distancing remains the best strategy for limiting the risk of infection for their newborn. This means that people who don't live with you should not come to see your baby until the COVID-19 pandemic has resolved. Use we can use social media or video application to connect with friends and family members. And all caretakers and parents should wash their hands frequently with water and soap for at least 20 seconds before touching the baby, and for sure before feeding the baby. We should limit the kisses. We should not kiss our baby too much. Okay, overall, avoiding taking the baby out of the house. We should wash the clothes and sterilize all utensils and articles that come in contact with you and with your baby. This is very, very important. Also, we should clean the room of the baby. And I want to tell you something. It's very important that we wash with warm water and soap. Please, avoid using chemicals.
Doctor, may I interrupt you on this point, Doctor? I am very sorry because our time is limited. And thank you very much for being with us today and sharing this information for everyone who's watching us through the KTV2, the family channel, especially the mothers. So thank you very much for being with us today. We are speaking to our guest, Marianne Assaf, healthcare coordinator. She's already sharing with us how to take care of our kids